Labret or Labret, or Lowbret or Lowbret. What you should know before you get one done, coming up next on Consultations by a Piercer, episode number 29. So stick around. For those that are new to the channel, first off, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and useful and all that fun stuff, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio located here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Now, the piercing we're going to talk about today is a Labret or Labret. It depends on who you talk to. I personally like Labret. It's how I was taught, but we don't need to argue about that today or in the comments. But traditionally, the main difference between this and a lip piercing is they are done lower on the face, usually done down in this area closer to the chin, below the gum line. Lip piercings are done more traditionally towards the top and usually to the outside edges of the mouth. Labrets can be done in groupings. They can be done in triangle patterns or slightly like what I would call flight formation, I guess, kind of thing, like a shallow triangle, diamonds, horseshoes, magical charms, anything you pretty much want, if you have the room for it in the anatomy. Now, this piercing is going to take anywhere from roughly 8 to 12 weeks to heal, during which time I'm going to suggest cleaning twice daily using a sterile saline spray. Personally, I like Nail Med's Piercing Aftercare. Comes out in a fine mist. You just mist it on there, let it stay in contact for 5 minutes, and then blot it dry. If you get the kind that comes out like a squirt gun, that you probably want to do compresses. Take a sterile piece of gauze sponge, saturate it, lay it against the area, or a clean paper towel if you can't find a sponge, sterile gauze sponge. Lay it against the area for about 5 minutes, and then dab it dry. Twice daily for at least the next 8 to 12 weeks, or until you stop seeing discharge, collecting and depositing on the jewelry, and the piercing will start to get that indented or ingrown look to it. Now, also, I do suggest at the end of your shower, pull your hair and everything out of the way and let the water flow over the area at the very end. Let the water kind of flow over the area and rinse off the area under warm water. What we're doing with these two things is helping to remove that limp discharge that hardens and crusts on the jewelry. We want to get it off there so that it doesn't agitate the piercing if the jewelry moves. Now, if you can't get it off or it seems like there's an obsessive amount of it, you may want to see your piercer and have them clean it for you. Don't get in there and start digging around with every implement you can possibly find in your closet. You're probably going to make things worse. Now, for the inside, I do suggest for the first couple of weeks that you take care of it by rinsing a couple times a day using Biotin antiseptic mouthwash or an alcohol-free antiseptic mouthwash. I like Biotin because it does help with dry mouth a little bit, which can be kind of an issue whenever you're healing out a piercing initially, oral piercing. The other thing is rinsing with warm water and sea salt a couple times a day. The formula is 1/8 of a teaspoon or a pinch per cup of warm water. Just rinse of it off and on for anywhere from 2 to 5 minutes, whatever feels comfortable. It kind of is more to take the kind of grumpiness out of it and make it feel good. Now, let's get into cross-contamination prevention. Common sense things mom should have taught you. Wash your hands before you handle it. No oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks. You are more acceptable to STDs during oral sex, so if you switch partners, practice safe sex the way you're supposed to. Do not stick unclean objects in your mouth. Pin caps, toothpicks, dirty fingers, other people's fingers, toes, I don't know, baby arms. Nothing in your mouth. Stop doing that. That's gross. Keep your utensils, food utensils clean. Do not share utensils with other people or food items with other people, like drinks and etc. Always a good idea to start off with a fresh toothbrush just to be on the safe side the day or the night of the piercing. Also, keep your environment clean. Clothing, bedding, towels, anything that may come in contact with this piercing needs to be cleaned on a regular basis, or contact needs to be completely avoided. Do not swim. I know you're going to hear all kinds of conflicting things on the internet about swimming and fresh piercings. The reality is that it is an open wound, both on the outside and on the inside. And most bodies of water, if they're large enough for you to put your whole body in it, are generally going to be full of microorganisms. Now, those microorganisms can work their way into the piercing and then cause issues. The other thing is with swimming is there is no way to swim without getting water in your mouth. So always keep that in mind when you're out swimming in that beautiful brown water. Keep pets away from the piercing. Do not let them sleep in the bed with you. Especially smaller animals like to sleep up by your face and lick you while you're sleeping. Now let's talk about trauma, swelling, and abuse. Do not sleep on the piercing. Make sure you're sleeping on your other side or your back or away from the piercing or figuring out a way to elevate it off the bed. Traditionally, these are done dead center, so that makes it fairly easy, but it's best to kind of keep an eye on it because that excessive pressure and movement will cause issues, including prolonging your swelling. Do not spin, rotate, or move the jewelry during the healing process. There is no reason to do that, and it is not a fidget spinner or a fun thing to play with. I know it's in your mouth, and you can't help yourself but touch it with your tongue and do all that stuff, but don't. Try to abstain at least until the swelling goes down. Swelling can occur usually in the first 3 to 5 days. You want to cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, things that are extremely warm in temperature, anything that may agitate your mouth. Good idea is if it hurts to do something or hurts to eat something or drink something, don't do it. It's bad. Simple foods are best. Soft foods are even better. Try to eat slowly and carefully. Take your time. If it takes you half an hour to eat a meal, it takes you half an hour to eat a meal. It's going to be a lot better in the long run once you've gotten used to it. Now, this piercing is not going to be as big of a hassle as, say, a tongue piercing is, but it still takes a little while to get used to. Doesn't really interrupt eating as much because it's kind of out of the way of everything, but it's a good idea to kind of take it easy for a little while. Now, cut down your intake of tobacco, hot and spicy foods, things that are extremely warm in temperature, alcohol, cannabis, anything that may agitate your mouth, vaping, citrus drinks, carbonated beverages, all that stuff. If you ingest something and it burns, don't ingest it. As far as food, that first 3 to 5 days, it's a good idea to stick with kind of soft foods. Things like yogurt, ice cream, sports shakes, nutritional shakes, baby food, applesauce, anything that you just kind of put in your mouth and it kind of just goes down easily. That movement and talking and etc. can actually agitate the piercing and lead to more swelling. So it's always best to kind of start out with simple things that don't involve a lot of work and then kind of get over that swelling, then move on to solid foods. When you move on to solid foods, stick with kind of simplistic things that don't involve a lot of moving around in your mouth until you get used to the piercing and kind of adapt to it. Some things you can do to reduce swelling. Gently sucking on ice chips for the first 24 to 28 hours. What I generally suggest is hit a convenience store, buy one of those giant tubs or glasses full of chipped ice right after you get it pierced. Also, staying well hydrated, eating lots of cold items. Sleeping with your head elevated above your heart will help. And basically, if you have never had any problems with any anti-inflammatories, such as ibuprofen, go ahead. It can help a bit. If you're in doubt, always ask your physician before you take any type of medication, even over-the-counter medications. Now, with this one, you usually sometimes will not see any swelling until the second or third day. Don't be surprised if you're like a day and a half into it and it's like, I haven't seen any swelling at all. And you go out and you decide you're going to go get some booze and have some fun, and then the next day it's 5 times its normal size. Don't let it trick you. Give it that full 3 to 5 days before you start messing around with things that agitate it. One of the biggest things that everybody always asks about is Coke or Pepsi or any type of Mountain Dew, any type of carbonated beverage. Sports drinks are not a good idea, like Gatorade, because it has a lot of salt in it. Your intake of salt will actually lead to more swelling too. The other thing to consider is stay away from energy drinks. Anything that's carbonated or fizzy is not going to feel good when it comes in contact with that open wound. Now let's talk about the risks that are involved with any oral piercing, and that's enamel erosion, gum erosion, and softening the bones. This one's a little bit lower on the risk depending on how low it is, but it can cause damage to your gums, can actually cause them to erode. I've seen them where if they weren't placed correctly or placed at an odd angle, it's actually eaten kind of a little hole into the gums. Yeah, it didn't look comfortable. The other thing is that it can affect the bone structure, that constant contacting and bumping against the with the jewelry. The other thing is swallowing parts. This one, not so much so. You usually catch it before it's gotten to that point, but it's always a possibility. So keep that in mind. Always check your balls. Now let's talk about placement, alignment, and jewelry type. Now this is pierced at a 90-degree angle straight to that tissue. The tissue's like this, it's pierced like this. That's probably totally out of focus, but you get the idea, just like a cross. Placement should be commonly below the gum line, but above where the phlenium tendon connects. If you take your tongue and you insert it in between your front lip, lower lip, and your teeth, you'll notice there's like a little tendon down in there. Usually we try to be above that area. It can be done below it, but it tends to be a lot more uncomfortable. Now, it doesn't need to be dead center. It can be off to the side, one side or the other, or multiple, like maybe 3 next to each other, or stuff that's over here. It all really comes down to your anatomy and having the space in there where there's going to be kind of a separation between where your teeth and gums are and your lip. We don't want something that's going to constantly be rubbing against it. So it's one of those things that you do need to consider. Now, don't be surprised if your piercer makes you do a bunch of funny faces. What they're trying to do is figure out how much you move your lower lip, how much that piercing is going to be affecting it, and whether it's going to go above that gum line and constantly agitate it. To start off with, that jewelry should be oversized. It should be a flat-back Labret stud. Back in the day, we used to do these with fishtails, and fishtails had a pretty good success rate, but you'd be hard-pressed to find anybody that stocks that stuff anymore. Basically, a flat-back Labret, threaded is best. Threadless, I'm still a little leery of how secure it is. It's going to be too long to allow for that inflammation. It should be downsized in roughly 4 to 6 weeks to a shorter post to reduce the amount of contact it has with your gums, teeth, and etc. And just for the sure comfort of it. Usually when you put that smaller one in, it'll start to nest a little bit. Nesting is really common with these Labret studs where this little indentation collects there, and it keeps the jewelry even further away from your gums. Whenever getting marked, if you're planning on doing any type of groupings or something to match this, I suggest sitting and mapping it all down each time you get a new piercing. That way you have something, kind of an idea of how they're all going to look together. It's very difficult to go back to an old piercing and try to match it to something else if it wasn't planned out all together at once. A little bit about anatomy. Most people do have the anatomy for this piercing. Ideally, they have a lower lip. And ideally, there's a little bit of space, roughly about 1/4 of an inch to a 1/2 inch, between when their mouth is rested away from teeth and gums. Most people, it kind of bows out a little bit, and there's a little bit of space there for the jewelry. We always try to produce a piercing that's as straight as possible so that disc will lay as flat against that tissue in the back. A lot of times, it'll look like kind of crooked on the front because the back is like this, and the front is kind of a little bit different shaped. Give it time. Once you put that shorter bar in there, it's going to straighten right up and look great. Any conclusions, some things that you need to consider. This will be affecting eating and talking possibly a little bit, off and on for about a week or so, maybe longer. So if you have any engagements that you have coming up, you might want to postpone getting the piercing done until after you're done with those. Second one is you need to change your diet for a short period of time. It's a good idea to stock that stuff ahead of time so you don't have to go out and shop the day of the piercing. Less stress that day, more just relaxing and getting over the piercing experience and enjoying yourself. Downsize. A lot of people forget to do this or they're too cheap to do it. You need to downsize to reduce the likelihood of damage to teeth and gums. Nothing sucks more than a piercing that was done perfectly fine and the person's had it for like 5 years, and suddenly they start discovering that they're having gum issues because they didn't downsize the jewelry. If you're going on vacation where you cannot control how clean the environment is and you're probably going to want to swim, you may want to wait until afterwards to come back and get this piercing done. The other thing is, if you have any hobbies, sports, or organized activities that you're involved with that have a dress code, I really suggest waiting until you're done with that activity to get this piercing. There is not going to be any way you can hide this short of having a huge, thick beard. It's just going to be one of those piercings that people are going to notice. If you are going to get it done, you think it's okay, check with the people in charge before you get it done, because nothing sucks more than getting a piercing, then going in there and then realizing, I can't wear this piercing. I have to take it out. The other thing is jobs, of course. I think that goes without saying. You want to consider those things too. No more reactions with this piercing, just so you know, because I kind of forgot it, kind of brazed over. I think I skipped it in the notes. You're going to see the piercing usually in that painful. It's a little uncomfortable to get done, just basically because we have the forceps down there inside your mouth, or you're doing it freehand. That part's a little uncomfortable, having people working around in your mouth. The piercing usually isn't too bad. You might notice a little bit of throbbing and aching immediately afterwards. Another thing that'll happen off and on during the first couple of weeks of healing is you'll see a white ring of tissue form around the inside of the jewelry, or inside of the piercing on the jewel, or around the jewelry on the inside hole. That's scar tissue. It's usually kind of white in your mouth. It's not going to be like it is on the outside. It's going to be clear or opaque. Also, it's not common to see kind of this yellowish, nasty, snot-looking stuff that hangs off the bottom. That's lymph discharge. That's just like the stuff that crusts on the outside, except it's warm and moist in your mouth and it can't harden. Just leave it alone. It'll come off the next time you rinse. Well, that's all I have to say about this particular piercing. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see if your body piercing needs in the future. Have a good day, everybody. Take care. Thank you for watching. We'll see you in the next video.